Hey, good evening, guys. My name is Dr. Nathan Thomas with Wellsway Yorkville. Happy Monday. Happy Labor Day. Hope you guys had a great day off. So today is a question and answer. I think people like question and answers the most, but also I didn't have as much time to prepare. I was out of town all weekend, so just got back early afternoon. So if you guys are watching right now, make sure that you say hello. Let me know also where you're watching from. I know right now we are streaming to both Facebook platforms, also on YouTube, and also on Instagram. Hey, Instagram, on my phone. They still don't have good platform software to be able to do it. So I am streaming from my phone. And then we have people watching right now from Mexico. That is awesome. Awesome. Welcome. From Australia. So before we do that, while we watch people come on, let's go over a couple of things when it comes to housekeeping, guys. Boy, this week we had a couple of posts, highly controversial, people arguing back and forth, trying to get their point across. And of course, on any kind of social media platform, no one has ever changed their mind arguing on social media. Interesting, right? So a couple of things. Inflammation. If you are watching it from the Chicagoland area, make sure you get registered. Go to the top. You go on Linktree. If you're on Instagram, you go to the top of the page. If you're on Facebook or on Linktree, Linktree is just a website that shares all of our different websites, so you can find it all in one spot. But our in-person inflammation event is going to be Tuesday, September 19th at 6 o'clock p.m. So if you're from the Chicagoland area, most of our capacity is to work in person. Everybody has to work remotely. And the in-person people we see during normal hours, and then the remotely working with people, we say, hey, you really need to be kind of out of the state, only because I only have limited hours to do that. But guys, I'm going to talk about inflammation here in just a second, because it is so misunderstood, and hopefully I can kind of change your mind a little bit and look at inflammation from a different perspective. But that in-person event is going to be Tuesday, September 19th at 6 o'clock p.m. And also, if you are from the contiguous 48 states and you're not from the Chicagoland area, you can go to Linktree and you can find the webinar and register for the webinar. And I believe that we run that every Tuesday and every Saturday. So Tuesday, I think at 6 o'clock p.m. Central Standard Time, and then Saturday at 9 o'clock a.m. Central Standard Time. But also, if you have an hour to spare, you can watch it on demand. So you can get it on demand, and you can be able to watch it right then and there. So specifically, if you want to work with me, and if we do have capacity, is kind of filling up, at the end, there'll be an opportunity to be able to schedule a discovery call with me. And that way we can kind of get the ball rolling as far as what we need to do. If this is something that I can obviously help you with as well. So guys, if you understand inflammation, you'll understand first and foremost why so many people are sick, but you also be able to understand some of the things that are actually causing it. So very, very important, because when it comes to weight loss resistance, this is like, or all these other health conditions, guys, if you don't know what inflammation is, where it's coming from, and what you could be doing to trigger it, everything that you do when it comes to your hormones, everything that comes to do with weight loss, everything that comes to do with all these different things, guys, it's literally like trying to push a boulder uphill, and you know how exhausting that is. So guys, inflammation is not necessarily a bad thing, but and I'll explain that in a second. But man, people just don't understand it, and it can be very frustrating sometimes. But guys, also coming up in October 24th, so this is, I think, like 6 weeks away now. Dr. Patrick Flynn, founder of the Wellsway and also author of the best-selling book, I Disagree. He is going to be in Yorkville for his I Disagree tour. So he'll be stopping in Yorkville. It's Tuesday, October 24th, 6 to 9. Guys, when you look at this, you will understand things so much better. In fact, including your hormones. What's really amazing is that even men and women don't understand hormones. And in fact, they just say, I'll just trust my endocrinologist. But guys, you can have a say in how you want your hormone health. You can have a say with your immune health. You can have a say in a lot of your health. But the problem is that we just leave it up to the experts. But even being an expert in a bad idea makes you an expert in a bad idea. It doesn't make it a good idea just because someone happens to be an expert. So he'll share his ideas when it comes to a different perspective. when it comes to a lot of different things, especially what's happened in the last 3 years, as well as hormone health, the difference between men and women, it's a very refreshing talk. And the number one thing that people say is I wish I had brought my spouse, whether that's a man that's coming or a woman that's coming. So get registered for that. Tickets will be going up in price September 24th, I believe. So get your early bird tickets. And yes, anybody can come to that, but especially if you're in the Chicagoland area, please make sure that you get to that as well. Okay. So I'm sure that we've had some questions that are going on. So make sure, guys, that I'll be taking some questions from Facebook, also from YouTube, and also I'll try to keep up on Instagram because I know I've already missed a couple of questions. But first, let me talk about inflammation, okay? I discussed this in our inflammation talk. Let me ask you guys a question. When you hear the word inflammation, what comes to mind? And I'll ask people this at the inflammation talk, and what they say is they say this, redness, swelling, heat, pain. And I say, congratulations. What you just described is you describe what's known as acute inflammation, an acute inflammatory response. Here's the next question that I ask people. Is that acute inflammation good or bad? And guess what everybody says? It's bad. And I'm like, why is that bad? And they're like, oh, well, you need to suppress it. I said, who said so? My doctor. If I have a fever, I'm supposed to take an aspirin or Tylenol. If I have a swollen ankle, if I have a sprained ankle, I better ice that. And I asked the question, I said, okay, so the body's messing up at that time, right? And they're like, I guess it is. See, we come from the perspective that the body doesn't mess up. It doesn't make mistakes. What the body is doing is exactly what it's supposed to doing. And in fact, when people describe an acute inflammatory reaction, we have been told that that needs to be suppressed, that we need to suppress that's bad. And in fact, when you look at an acute inflammatory reaction, guys, that is how what the body does, the immune system does to initiate a healing response. Without an acute inflammatory reaction, you do not heal. And so an acute inflammatory reaction, that's why I tell people, it's like, do you ice? No, we don't have any ice in our office. And I have gotten some doozies of injuries for me, and I don't ice it. That's why people say, well, do I take an aspirin for a fever? I'm like, nope, my kids have had fevers. Yep, they've been up at 104. We've not given them any aspirin or any Tylenol or anything like that. You guys realize my kids don't even know what that stuff is. They don't. Yeah, we're the weird people on the block. And I'm like, I will gladly take it because I have a 16-year-old, a 14-year-old, a 12-year-old, and also now almost 7 months. You know that they've never been on an antibiotic, a drug, or anything for that matter. And I'm like, yeah, I'll gladly be the weird people on the block. But look at the result. Look at their health. And at the end of the day, what do you want most for your kids? You want them to be healthy. So what we're taught that acute inflammation is bad and that it must be suppressed. And then when it comes to chronic unrelenting inflammation, we're told nothing about that. And in fact, I want to give you an example. If you fell down because you decided, hey, I'm going to start walking every day, I'm going to start jogging every day, I'm going to get in shape. And every day you came across a buckle in a sidewalk. And that buckle in the sidewalk, you always hit it, you tripped on it, you fell down, and you scraped your knee and you injured your knee. You scraped the skin is what you see on this picture here. And you see that the body initiates an inflammatory reaction in order to start healing the skin. Whatever happens after you hurt your knee, that's actually a good thing. So that's an inflammatory response. Now, let's say the next day you walk again, you run again, you hit the same buckle, and then you reopen, you re-injure it. And then that proceeds to happen every day for the next 6 months. And so what happens is over 6 months, you are continuing experiencing an inflammatory response. So let's say the next day you decide, you know what, this isn't healing, and I guess I need to go to the doctor and try to figure this out. So the doctor looks at your knee, runs all kinds of tests, tissue biopsies and imaging and lab work. And they come back and they say, you know what? Yes, what you do have is you do have a case of knee scabitis. And you shriek because anytime that you see, or they could probably make it in Latin and call it like genu scabitis or something. Call it, Latin that makes you really scared. And so and then you're like, okay, finally, I have a diagnosis. I have a diagnosis. And the doctor says, yeah. And what we need to do is we need to give you some things in order to suppress that inflammatory response, because obviously the body is messing up. But meanwhile, you never told them that every day for the last 6 months, I've continually falling on this knee, and I've opened it up and I've re-injured it. Meanwhile, guys, if you came to me, I would say, what are you doing to injure it? They're like, well, I think I've been falling on it every day because I've been exercising and I hit the same buckle in the sidewalk. And I say, okay, great. Maybe you should look down, or maybe you should take a different path, a different direction, and maybe just kind of avoid that. Okay. Maybe we should avoid that. But the thing is this is, and here's the question that I ask, is that if you keep re-injuring it, yes, it will never heal. The first thing that you need to do in order to help with inflammation is to figure out what you are doing to injure your body. And this is how we look at things differently, is that we say this: what if your illness, what if your fibromyalgia, what if your endometriosis, what if your painful menstrual cycles, what if your type 2 diabetes, what if it wasn't an illness? What if it instead was an injury? Wouldn't that be really good news? Because an injury has the capacity to heal. You need to figure out, what am I doing in order to injure it? But everything today in medicine is that they call it chronic degenerative illness. What they should be calling it is a chronic degenerative injury that's never been given the opportunity to be able to heal. And the thing is that your immune system is not messing up. If you look at what the job of the immune system is, it is to be able to handle a bacteria. It's be able to handle a virus. It's designed to handle a toxin, and it's also designed to go after a food protein. The job of your immune system is to go after foreign proteins. And if you understood that and you came from the perspective that the body was not messing up, now that gives you a whole different perspective when it comes to infection, when it comes to your hormones, when it comes to autoimmunity, gastrointestinal issues, things like that, all the different things that we are suffering from. Now, even take it a step further. What if all of the issues that you're experiencing with your hormones, what if the hormones aren't making you sick? They're responding to you being sick. So you see how many people run after hormones and hormone replacement, and replace this hormone and mess with this level. And meanwhile, what if the body is merely responding to inflammatory stressors that are taking place? That's caused by physical trauma, by chemical inflammation, and also mental stress. Now, think of this. What if I could get those things under control and figure out what is causing that and start to improve those three things? And what do you think the natural progression of the body is? It's to heal. That is how the body is innately programmed. It's programmed to heal, adapt, and survive. But you know what we do instead is that we call it an illness. We call it genetic, which then absolves us from any responsibility whatsoever. And then as soon as we're given the label that it's genetic, then that says, oh, thank God. I knew it wasn't any of my fault. So now I can keep living the same destructive lifestyle that caused it. And now I'm going to continue to cover it up with medications. So guys, when it comes to acute inflammation, it's good. And it's caused by injury. But when you talk about chronic unrelenting inflammation, medical doctors even know this. Medical doctors know this because look at every single drug that's out there, and how do they handle chronic degenerative illness? They either give you a drug for the effects of chronic degenerative illness, or what they do is they'll do things in order to knock out the immune response, in which the immune system is just trying to do its job, especially when you are talking about autoimmunity as well. So I talk a little bit more about that when it comes to inflammation in the inflammation webinar or the in-person inflammation event. But here's another thing, guys, that I want you guys to understand too, is that your immune system isn't sitting in your blood. It's majority of your immune system. We're talking 85% of your immune system. You know where it sits? It sits around your barriers, which means that your immune system is sitting underneath the skin, underneath around the lungs, around the gastrointestinal system, around any place that comes into contact with external and internal environment. That's why, guys, if you've ever heard, oh, the immune system lives in the gut. Well, it doesn't live in the gut because it's just the gut. There's a large part of your immune system that lives in the gastrointestinal system because it's a barrier and it's coming into contact with the external environment. Yes, your gastrointestinal system is still considered your external environment. And that's why it's so amazing, because I want you to think about it. Your body wants to handle a foreign protein at the barrier and not once it becomes systemic inside of your body. It wants to handle it at the barrier. So anytime you're talking about inflammation, inflammation needs to be handled at the barrier. Yet for some reason, we think that we can bypass the barriers and somehow try to put proteins by bypassing the barrier to try to stimulate an immune system response. It actually doesn't work that way. It goes against a physiological response. It also makes you wonder why, when they try to put proteins bypass the barrier, what do you think they need to do in order to try to heighten and stimulate an immune system response? They need to put aluminum as an adjuvant in order to heighten the immune system response. That doesn't make a whole lot of sense. We all know that aluminum is toxic, all right? So this is why when it comes to inflammation, you have to know where it's coming from and what you're doing. It's the same thing when it comes to a scab. If you have a chronic condition that's not healing, first figure out what you're doing that's creating a chronic inflammatory response. And rather than cover it up, work on getting to the cause. All right. So I'm going to go off my soapbox for now. Let's go over a couple of question and answers. Okay. And so if you guys got questions, I'm going to try to keep up and with you guys as much as possible. So from Instagram, what do you recommend for normal iron and ferritin? Normal iron and ferritin. And I would say if your ferritin levels are getting up above into triple digits, that usually is an indication of fatty liver. And if you are below like 10, that can indicate that you are anemic as well. That's why we look at ferritin levels. Ferritin can also go up when you do have an acute infection. So I've seen very high ferritin levels when people do have an acute infection. But also, we always will check ferritin levels specifically if we're starting to do anything in regards to pushing things through the liver, i.e. detox, because you can strip your ferritin levels, which is why we'll give people some higher doses of natural iron coming from desiccated organ sources like spleen and liver in order to try to get those levels up. And guys, I've always said this too, is stomach acid is so important for iron absorption. So stress lowers stomach acid. And so that's why women stress more. And they also, if they're menstruating, they bleed more. So they're going to need a lot more iron in their diet. Okay. Let's see here. And I'll go ahead and try to catch up here. All right. Can you recommend a doctor in Pittsburgh? What I would recommend is go to thewellnessway.com, thewellnessway.com, and then find a doctor that might be close to Pittsburgh. I'm unsure if there actually is. And then if you can't, then reach out and see if you can work one remotely. Okay. All right. So let's start going over some questions here. And if you guys are watching on Facebook or on YouTube, you'll be able to see some of these questions that are coming up. So what do you think about sunscreen on the face? I'm actually not a fan of sunscreen at all. I'm not also a fan of burning at all. We do need a level of sun. We shouldn't burn because burning will cause oxidative damage. But the whole idea of completely avoiding the sun, not a good idea. That's why, guys, have you ever seen people, well, the sun is going to cause skin cancer. Have you ever known someone that got skin cancer where the sun has never shone or the sun has never burned that specific area? Skin cancer is a lot deeper. Here's something that I even talked about too. Do you guys know that if you lower your cholesterol levels to ungodly amounts, you'll notice that there will be problems with the skin drying out? That's why you get dry mouth. That's why you get dry lips. You start seeing very big changes when it comes to the skin drying out. Do you know that your body needs cholesterol in order to form a protective barrier on your skin to leave things out? And so think of this. What if someone's on a cholesterol medication and then that barrier is not there anymore? Does that actually, can that cause problems with toxins that you are putting on your skin being able to seep through? I would say yes, the skin is a barrier. And so having a healthy, strong barrier does in fact require cholesterol in order to build that barrier between the skin and the external environment. Now, can you do natural sunscreens and things like that? Yeah, things like even coconut oil can be a natural sunscreen. Okay, so coconut oil. Now, I actually will go out in the sun, and I haven't burned once this year. Here's what's also interesting too about burning is that they've even have shown that people with healthy antioxidant levels underneath the skin will burn a whole heck of a lot less than people without that. So even your antioxidant level can determine how quickly that someone will burn as well. Okay. All right. So thank you, Sheila, so much for that question from Idaho. Once you told us that a tablespoon of apple cider vinegar before eating to increase your stomach acid, can you do this before each meal, or can you dilute it with water so you don't have to take a tablespoon at full strength? All right, that's general rule. I do think that adding in apple cider vinegar will help with stomach acidity. What's interesting is we just had a patient who she had symptoms of having just low stomach acid, and about 4 weeks in, she's like, I know that you recommended like 2 of these betaine hydrochloric acid, which is the strongest stomach acid. She's like, it's starting to make my stomach hurt a little bit prior to eating. And I said, okay, that's really good news because your stomach acid is starting to improve. And so, hey, go down to 1 and hopefully you can go down to 0, or maybe just take a little bit of apple cider vinegar before you eat. So apple cider vinegar is going to be the lowest acidity. Can you dilute it? The answer is yes, you can dilute it. In fact, sometimes if people say, oh, I hate it so much, or, it burns a little bit, I say, yes, you can dilute it in things like aloe juice, aloe vera juice. And that's okay to do that as well. But sometimes people just want to take it apple cider vinegar with some betaine hydrochloric acid in pill form too. So, but apple cider vinegar is just going to be just a lot cheaper for you than having to take it into pill form. All right, let me see. So from Instagram, how do you bring up my white blood cells? My doctor told me that the COVID, messed up my white blood cells. I am sorry to hear that. From Instagram, uh, go back and you only will see this video on Rumble. If you go to Rumble, which is another video platform, the very first video that I uploaded, I even showed what was happening. You'll see pre and post what happened to the immune system in an individual. Here's what's also interesting though, is even when you get a flu vaccine, they actually will say, like, don't get any blood work because you'll see your white blood cell count go down, which kind of makes you wonder. Have you ever noticed someone that got a flu shot and they're like, oh my gosh, I was never sicker than after I got my flu shot. And people think, well, it caused the flu. Didn't cause the flu, but if it causes a lower immune response and it caused destruction of white blood cells, so your overall white blood cells or your lymphocytes or some of the CD8 cells that are responsible for killing off a viral infection, if those things went down, then your susceptibility goes down for any kind of virus as well. So what happens if my white blood cells go down? Here's what's interesting is I had somebody reach out to me. This was probably a week ago. It says, my son constantly has low white blood cells, and the doctor just looks at it and says, we're going to monitor it. And I mean, that's almost like saying, hey, we have a little fire in your house right now. And, it's not enough to call the fire department. So let's just keep an eye on it. Well, you realize that doctors don't have an answer for low white blood cells. Yeah, sometimes people aren't eating enough. Yeah, they're not getting enough protein, or they may not be absorbing protein and things like that. But if you have had some kind of injection and you're constantly seeing a low white blood cell count, there is something. Think of this. What can cause immune system depletion? Toxins and viral issues. Toxins and viral issues. If you even see people with Epstein-Barr virus, and you can see over time, you'll see the immune system exhausted and you'll see very low counts. So that's why chronic viral infections can be absolutely devastating. And so can chronic Toxicity issues. You will also see very low counts in people with mycotoxicity. You'll see everything low, including low white blood cells, immunosuppression. And you'll also see people when they're dealing with so many immune system issues, you'll also see them very low in specific hormones and things like that. So what do you do in order to get your white blood cells up? Number one, figure out which white blood cells are low. So are they the neutrophils? Are they the specific types of, are they monocytes? Are they eosinophils? Are they the lymphocytes specifically? Expand on it. CD8, CD19, CD4, CD56. Those are natural killer cells. These are killer T cells. These are helper T cells. And these are the B lymphocytes. And so, yeah, by looking at that, are there things that you can do to help with that? Yeah, number one, figure out what was skinning the knee so much. But then there's other things like Echinacea astragalus, even medicinal mushrooms like reishi, chaga, even wormwood, depending on which ones that it is. All of those things, can help. But that's why we test and we never just try to guess. But I'm sorry to hear that your immune system is low, because just remember, chronically low immune system makes you a lot more susceptible to viral infections and even cancer. Who says so? When you look at people on long-term medications for autoimmunity that is trying to suppress the immune system response, look at the effects. The effects, and they'll say, can cause cancer later on. Okay. So who says so? They do. Okay. All right. Let's see. Let's answer another question from Facebook. Amber asked the question, what is a good pre-workout for a 6-year-old boy athlete so I can get him to stop buying all the bad stuff? I'll be honest with you. I don't do any pre-workout. Okay. So for me, I never do any kind of pre-workout. And it also depends on what he's doing for a pre-workout. Can caffeine help with performance? The answer is absolutely yes. But this whole idea of taking protein or taking peptides or things like that prior to a workout, I want you guys to understand this. When people say I'm going to take peptides prior to a workout, or I'm going to take protein prior to a workout, do you guys know how long it takes for protein to get digested? It's about 3 to 4 hours. So you're going to take protein, then you're going to work out, which is going to put you into fight or flight. That's going to just sit there in the stomach. It is not doing anything for your workout. And in fact, I would say it would even be detrimental as well. So I work out fasted. The only thing that could probably help a little bit is some caffeine. But I don't know if you want to have a 6-year-old boy that's going to do that. But really, I would say, because my son is 16, the only thing that I allow him to take is about 5 grams of creatine per day, and that's about it. And so what fuels his workout is great eating, and what also fuels his workout is that he's extremely young and he gets very excited about working out. So thank you very much for that question. All right. So I think that my son are dealing with environmental mold toxicity, how to prove it to start treating. All right. So from Facebook, if you do have environmental mold toxicity, I will say this, the number one thing really is going to be water damage mold. So if you're not for sure or not, because if you are living in a water damaged mold environment, I had a conversation with a woman, and this was last Friday, and she said, like, my hormones are just out of whack. They're just something's not right, and I've just been having hormone problems. And then she said something. It just felt like it got worse when I moved into a different house. I said, "Oh, okay. Well, tell me about the house. Is it old? Yes. Has there ever been any kind of water damage? Probably." So I'm like, okay, the first thing that I want you to do, especially if you're talking about just more than yourself, and this is happening in people who are sharing the same environment, first and foremost is get an ERMI test. So ERMI, ERMI test. Environmental readiness mold index test. You can go online, you can order it. And I would just order the ERMI, because there's also the Hurts Me option. Just order the ERMI test. And basically what you do is you do a Swiffer test, you collect it, you send it off, they do an analysis. I think you get the results back probably in about 2 weeks, and just start there. And this will look at the presence of, yes, is there any kind of environmental mold, but really one of the things that's causing the issues is water damage mold. So mold due to leakage, whether it's plumbing or foundational leaks or roof leaks, water leaks coming in through the windows, or also if your humidity in your house is way too high, because humidity should be around 68 to 70%. That's why if you live in a south, like down in the southeast, in which it's very humid and very, wet, that's why you need something to control the humidity, because the humidity in and of itself can cause some issues with mold, especially in your heating, ventilation, and cooling. So that's a great place to start, is do that through an ERMI test, and then you start from there. Don't try to treat any of the mold until you first establish that it's there, because if you're trying to do anything with that, all you're doing is you're trying to plug a hole, but meanwhile you're getting other holes in some areas. So it's like trying to plug a dam that keeps sprouting new holes. One thing that you can do if you do think that that's an issue is protect your sinuses, protect your lungs, because you're breathing that in. So remember, you're not eating it. You can get mold from food, but you're most likely going to be breathing it in. So what you want to do is just make sure that you're protecting the sinus cavities, because you should be breathing primarily through your nose. And that's why things like colloidal silver can help to protect the sinuses, because you can get mold even growing within the sinus cavity as well. And colloidal silver spray can actually help with that. Just in the meantime, I help you tread water so it doesn't get any kind of worse. So thank you, Lisette. That's a great question. What about this one? What do you think of chlorine, or what do you think about swimming in chlorine pools? And then Gina from Instagram will talk about this as well, about your questions. So one more question from Facebook. We'll bounce back to Instagram. So what do you think of chlorine in pools? I would say this is chlorine is a halide, and chlorine can compete with iodine, which is why we always say, hey, you got to watch it as far as bromine, iodine, and fluorine or fluoride. These are also these are halides, also in the same elemental category as iodine, and so they can compete for binding sites for iodine uptake in the thyroid. If you look at brominated vegetable oil, gosh, I don't even know if it's still there, but I remember seeing Mountain Dew contain bromine. But then you also have chlorine. Now, I would say this is probably the least of your concerns would be chlorine in an outdoor swimming pool. Okay. I think that it would be worse if you were drinking it. But I think there's a lot of other things that can be worse. Obviously, if you can avoid it, it's always the best thing. I really think where a lot of people will run into problems is, I want you to think of people who are competitive swimmers, and they spend so much time in a very warm, humid, chlorinated pool indoors all the time. And that can be breathing most of it in. And so I think breathing it in is the worst thing. And so if you have an outdoor pool that's been chlorinated, that's probably not going to be as bad as if you had an indoor pool that's very warm and humid, and when you walk into that pool, you can smell that, and then constantly being exposed to it as well. There are things that you can do in order to have like natural swimming pools, or you can put different types of pumps on the pools that you don't necessarily have to have chlorine in it. But it does make it a lot more expensive, more than a little bit. It makes it more expensive, a little bit more difficult to maintain. Okay. All right. So from Instagram, Gina Mac 22, I have vitiligo, which was pretty dormant for years, and after COVID, spread all over my hands, feet, and face. I was also recently diagnosed hypothyroidism. I'm going to get off all medications. Okay. So vitiligo, obviously autoimmune, and the immune system is going after some of the melanocytes of the skin, but then there's also hypothyroidism. So the number one thing is, when it comes to autoimmune, is figure out why the immune system is doing that. So a lot of times we'll run different panels to figure out why is the immune system trying to clean up certain things as well. Here's what's interesting when it comes to any kind of autoimmunity is that most people don't have one. So most people don't have one autoimmune condition. It's just that once a doctor diagnoses one, then they're like, okay, we're done now. We found it, but you realize is you can do a panel through Aurora Life Sciences. I just ran it on a woman because there was just a lot of things not making sense. And so she had Hashimoto's and she had Sjogren's, but she also had building antibodies for lupus as well. So what's interesting, guys, is that most people don't have one autoimmunity. They have usually a couple, and then they'll also have subclinical antibodies to different things. So that's why when you look at autoimmunity, guys, whether it's lupus, Sjogren's, Hashimoto's, or rheumatoid arthritis, or whatever, it's just describing where the immune system is acting up. And don't think of it as the immune system messing up. Think of it as why is the immune system trying to clean out these areas? So is there an infection there, or is there something that has some tissue damage that's taken place? Take Hashimoto's, for example. So most of Hashimoto's is due to a increase in viral load that the body is trying to handle Epstein-Barr virus, but it also can be caused by if you don't have antioxidant support in your thyroid, like selenium, in order to prevent, because when you make thyroid hormone like iodine, it can cause oxidative damage. And so that's why we have antioxidants in order to prevent that happening. So iodine can be the fuel for creating oxidative damage, but the selenium is one that's putting out that fire. And so I know that we just had a woman, this was maybe 6 weeks ago, her thyroid antibody levels were just unbelievably high, 4,000. And we did it again about 4 months later, and it got down, I believe it was like 1,800. Still a long way to go, but you're seeing that there's less damage that's taking place. So that's why whatever autoimmune condition that you have is, there's a lot of things that you can do. Because remember, that's why we focus on the gastrointestinal system so stinking much, because a lot of what we eat can cause an inflammatory response. All right, from Instagram, how do you know what magnesium supplement with, and should we take a little bit? I believe that you can get magnesium from your diet, but just most people don't. Mostly what I take is magnesium citrate. So we do have a product that's known as Relax Magnesium Citrate. And yes, it does help you to relax. There's also magnesium threonate that also can be good as well. So sometimes people like taking magnesium on the skin, like a lotion or a spray. Sometimes it can burn a little bit as well. I think the RDA of magnesium is 650 milligrams. Usually if you take a scoop of magnesium of Relax, you're getting almost your full RDA. But remember, anything that comes from the ground that will contain minerals that's in it. So, but you can become mineral deficient, especially if you work out quite a bit. If fitness is this, and it looks like from your profile picture, fitness is very important to you as well. All right, let me see if I can answer another question. So from Jamie, trainer Layton, almost 2-year-old grandson with horrible eczema, heartbreaking to watch him, especially when tired, scratchy, he's bleeding everywhere. Also, is this becoming more common, or am I just noticing it more now? No, I believe that eczema is becoming more and more common. Okay, I really do. And let me give you a clue, right? Eczema is an inflammatory response. Okay, eczema is an inflammatory response. And so that's why a lot of times what we do is we look at, is something insulting the skin? And I'm like, it could be, it might be, but just try to figure out where it's at. And I'll actually give you 2 stories. Here's the first one. I remember my son, when he was about 8 years of age, developed terrible eczema on his wrist. So he had it on his wrist, and it stopped right here. It went from here to here, but it stopped right here, almost as if like it was just it was like a perfect line. And we looked at it, and I'm like, Jacoby, so are you putting anything on your skin at school? He's like, yeah, Dad, I'm washing my hands using the school soap. And I'm like, that's the most caustic, cheapest soap, most damaging soap that you could use. And it was really irritating his skin. And the reason why it stopped right at his wrist is because he was wearing a long sleeve shirt. I said, Jacoby, you don't use that soap at school. I'm like, just use some water, but just don't tell anybody that you're not washing your hands. But please don't use that soap. And in about 5 to 6 days, it went away. Now, there was another time that my oldest son developed eczema on his shoulder. So he started to develop an eczema patch on his shoulder. Now, here's what's interesting. The eczema patch happened at about 4.5 months old. This was over 16 years ago. And yes, this was before I kind of knew any better. Before my wife knew any better, we were young parents and, really stressed, and we probably should have known better. And yes, it was our fault. So many people just don't want to take blame. It was my fault that our son developed eczema. And so I remember my wife, she's like, hey, Talon has eczema on his shoulder. Like, why is that? Our son wasn't even, didn't have the what or any whats. But one of the things that my wife decided to do, because at that time that was supposed to be normal, is that she started to give him rice cereal at about 4.5 months of age. She said, the only thing that I've done different is I started giving him rice cereal. And I was like, oh, don't give him rice cereal. She's like, why? That's what all the pediatricians recommend. And I said, because at 4.5 months of age, his gut is wide open. Babies have a leaky gut. They have a leaky gut, and it's not some kind of deficiency. It's because they have a wide open gut because the components of mom's breast milk is too big to pass through the gastrointestinal system through the cells, and it has to go around it. And so that's how the baby gets immunoglobulins. It's how they get, components of their immune system to build it up. And so I said, stop giving him rice milk, please. Please go back to breastfeeding exclusively. And within about a week, it cleared up as well. So if your grandson has eczema, then there's some kind of inflammatory component that's taking place. And they also, depending on when they started getting food, could have now developed many food allergies, especially if they're exposed to foods prior to 6 months of age. And really, I would say don't even consider food until about 9 or 10 months of age. So now they can develop food allergy. They eat those things and they're having a massive inflammatory reaction. But then also what can also cause terrible eczema as well is go back and say, have they had any bad reactions at 6 months, 12 months, 18 months? Go back and look when it really started, and that will start to give you some clues. Okay. Let's go back to Instagram. Guys, thank you so much for your questions. Sarah Lynn's Life. I find it confusing why something like gluten seems to cause the chronic injury that you refer to, and others are just fine with this. Is this genetics? No, it's not genetics. But the thing is that gluten in and of itself will open the gastrointestinal barrier. Some people are more injured than others. So gluten, I tell people, everybody should be gluten-free. You should be gluten-free. However, some people have more gastrointestinal, damage. And if you do have more gastrointestinal damage, then you are going to have more of an inflammatory reaction from gluten. There's no doubt about it. And so that's why I say if people are reacting to it, and I say, well, the only people that react to, to gluten is, those with the autoimmune reaction to it. And I'm like, guys, I avoid gluten. I don't have any gluten. If I do have gluten, I may not notice it right away, but if it keeps happening, I'll notice that it'll continue to get worse and worse and worse. So that's why gluten, the subprotein of it is known as gliadin. Gliadin signals the gastrointestinal barrier to start to open up. High DHEA levels. If this is in a woman, then I would say check your blood sugars, check your insulin levels, especially. Look at those things, and then look at some of those hormones, see if you're very androgen dominant, and see if you're having a hard time converting those androgens down into estradiol. So high DHEA usually is a lot of blood sugar issue, eating a lot of high insulin levels, high sugar. Get those levels checked, and then also see like even what testosterone levels, what the estradiol levels are. So a lot of times high DHEA would be a PCOS type of situation. What is the solution for hair loss at age 50? My iron and ferritin levels are on the low end. I go back and watch a video that I did. Hair loss can be immune, like shock loss. Hair loss can also be thyroid related. It's not necessarily going to go out hair loss, but as far as the quality of the hair or how quickly it's growing and like how thick it is, hair loss can also be related to your hormone levels, especially after menopause. If you have lower estrogens, you're going to see a change in your hair. And then hair loss can also be due to high DHT levels. And that after menopause, you will see that you'll go into a male pattern balding type of situation. So my iron and ferritin levels, if they're on the low end, figure out why they're on the low end. So that's why a lot of what people need is they need more stomach acid. I even have told people their iron levels are so low that they need a bag of iron. So they should get an infusion in order to get those levels up. And then we'll figure out later why it's so low as well. Thank you guys so much for the questions. I apologize if I skipped anything over. I'm trying to do the best that I can. So I appreciate you and speaking truthfully. Oh, thank you, Organic Skeeber. Thank you very much. Sorry, guys, if I pronounce your names wrong. Any tips on mastitis from breastfeeding? Currently suffering and wanting to avoid antibiotics. Oh, yeah, my wife has had this a few times. Warm compress can help draw some of the infection out. People think I'm 100% against antibiotics. But usually warm compress, sometimes putting silver on it, can help. There are times where you need to be on antibiotic. There are times. Now, I would probably say it's about 1/20th of what doctors are recommending for it. But I definitely wouldn't want to go back to the days of not having antibiotics as well. I just think that they're overprescribed way too much. And in fact, some of the things that we do puts people in a situation where they need to go on antibiotic because it's actually what they've done is caused people to need to be on an antibiotic. So try doing that out. Hopefully that'll help. So I'm sorry, but bless you for breastfeeding. So that is breast is best. Always, always, always. Had a provoked blood clot in October 23. Thoughts on the Lovenox shots when I have no clotting disorders and no complications of pregnancy so far, 15 weeks today. Man, I honestly, that's a great question. And I don't know a ton about the Lovenox shot, but I'm guessing that they are saying you have some kind of clotting disorders in October 23. Yeah, I don't. The only thing that I would say is go back. If you did have some kind of blood clot, think about were you on birth control? So were you on there's certain types of birth controls that can cause issues with clotting. So I have had women come in that said, yeah, I had a stroke and it was from 100% from birth control. So that caused a clotting disorder. All right, from Instagram, is there a way to reduce stubborn subcutaneous fat? That is a great question, and that's a long answer. So, but fat that's going to be underneath your skin, and I would actually say this is work on getting rid of sugars. Get some blood work done first and foremost. Work on cutting out sugars. And what I mean by sugars is any processed carbs. Okay. Please just get rid of any processed carbs without ever looking at any testing or anything like that. The other thing is start sleeping enough. Start sleeping If you're a man, 7 hours. If you're a woman, 9 to 10. 7 to 8 for men, 9 to 10 for women. But restricting your sugars, you can go to Linktree and look at the no sugar diet guidelines. That can help quite a bit. So, and also subcutaneous fat, and this is going to be different for a man or a woman, is start exercising. Well, what do you mean? What kind of exercise? I'm like, you know what the best thing is? You know, it will change your body the quickest. And everybody's different because depending on some people, I tell them you're not even ready to do this. But sticking to very short, intense exercise, literally like what you need is probably 5 to 10 minutes of very high intensity exercise 3 to 4 times a week, and then start doing weight training like squats, deadlifts, and presses. You will see. What's interesting is even if you look at CrossFit, and CrossFit does have its problems, there's no doubt about it. CrossFit has problems, especially in the competitive aspect of it. But if you look at women who are in good shape, and yes, some of them do have some hormone issues, but you look at women and men, they don't have cellulite or things like that. They just don't. A lot of it just has to do with how they train. So, all right, let's go back to Instagram or to Facebook. I had a hysterectomy 8 weeks ago. My incision got infected with areas of drainage, no fever. Should I not be on an antibiotic? No, you probably should talk to your doctor in regards to that. So it's very common for the incision to get, we need, if you've had an incision, it's common for it to have an infection afterwards. So from YouTube, is it true that as we eat carbohydrates, our need for vitamin B1 goes up? I would say yes, if you have diabetic neuropathy. So if someone does have a diabetic neuropathy, they absolutely need to be on vitamin B1. There's no doubt about it. So, but I don't think that you should supplement them if you have necessarily a donut. Okay. From YouTube, any thoughts on the carnivore diet? The carnivore diet, I've done some videos on some short videos on this, maybe even some long videos too. The carnivore diet is this. It's the ultimate elimination diet. So when someone says, I did I did amazing on the carnivore diet, and I'm like, well, if you just basically are eating red meat, organ meat, eggs, and now, apparently now they're saying, hey, maybe you should eat some fruit and things like that. Well, you are going to eliminate probably a lot of food allergies that people have. When we test for IgG food allergies, you know what we see the most of? We see the most allergies to grains, and we see the most allergies to seeds and grains. And so if that is true and you expand that on a majority of the population, then as soon as you eliminate seeds and grains, you're going to eliminate an inflammatory response, which I believe is why people swear by the carnivore diet. I believe that you eliminate a lot of inflammatory things that are going on. But also don't demonize carbs, because you do need carbs. Okay. Try working out without any carbs. You will not do very good. So do you need carbs? Yes. And that's why we never put people exclusively on a carnivore diet unless they just had way too many food allergies. And I'm like, you're going to be regulated to just beef, beef and organ meats and things like that. But, try to get some veggies in with it too. So, so do I think that the carnivore diet is good? It depends. But if you stick to meats and veggies, low glycemic veggies, a lot of people do pretty doggone good with that. In fact, I had a man, he's lost 100 pounds in about 9 months. And we didn't put him on carnivore, but he also got off of 7 medications at that point. So I think that if I had to make a choice between being vegan and carnivore, I would choose not necessarily either, but if someone held a gun to my head, I would choose carnivore over everything else. All right. So thank you so much for that answer. Oh, Lisette, that's my pleasure. Yes, if you're on birth control and you're on a leg cast cleared, of clotting disorders, then I don't see why there would be. Talk to your doctor, but if birth control can cause clotting issues as well, so is inactivity being in a leg cast as well. How do you feel about Hawthorne supplement for high blood pressure? I'm not a fan of any supplement to try to manipulate blood pressure. You know what works best for blood pressure? Medications. Medications always manipulate. So a lot of times people are like, well, I don't want to do medications. I want to do the natural approach. You know what's even more natural? Find the reason why you have high blood pressure. So the reason why people have high blood pressures is it's inflammatory. You are losing you have endothelial dysfunction, probably some issues with nitric oxide production at the endothelial lining. It can also be related to stress, and it can also be related to having low potassium. So low potassium can cause high blood pressure. That was why when I was young, I was an athlete. I worked out all the time. My blood pressure, even when I was 13, 14 years of age, was always like 135, 140 over 70. So it was actually high. And I was so stinking deficient in potassium because I ate nothing but fast food. I didn't eat anything with potassium. So get to the reason why someone has high blood pressure as well. Now, one of the things that we may put people on for a time being, if they do have high blood pressure, is known as NEO40, which is actually beets and high B9, B12. And I'm like, okay, this is pretty powerful. But if you start waking up and you're dizzy, start taking your blood pressure and you start getting dizzy with exertion or dizzy in the morning, really low blood pressure, then the cool thing is it's time to talk to your doctor and ask them to start taking you off an ACE inhibitor or metoprolol or something like that. So, and remember, I can't get people off of medications, but I can tell them, hey, here's what I would start asking your doctor as well. Okay, let's see here. All right, from YouTube, do you suggest delayed schedule for doses of babies or skip them altogether? We haven't given our 6-month-old and are waiting, or you're 2 years old, or waiting for 2 years old. So a lot of people want to do the whole spread out the schedule. If you guys know what I'm talking about with the spread out the schedule, here's my opinion. It's almost like if I wrote out the word toxic, like really little, but like let's spread it out, and it's still toxic. Okay, some people say I want to spread that out, and I'm like, it's still toxic. There's still toxicity that's involved with it. So that's going to have to be your decision as a parent. I can only say that my kids have not actually gotten anything. So, and I'm sure someone will call me a bad parent for doing that. All right. All right. Why does teeth have to do with it? Oh, I think you're talking about chewing. Yeah, look at babies and see when they're developing the types of teeth. And there is like, hey, types of teeth determines what they can start to eat. So they start getting molars. They have the ability to grind. If they get the incisors, babies have the ability to tear things in the front. They have the ability to bite into things, which is why like incisors is more going to be associated with meat, and things that require molars like to chew and grind up is going to be more associated with things like veggies and grains and things like that, which I don't necessarily recommend. All right. All right, guys, let's see any other questions. I know that we're coming up to 8 o'clock, so I appreciate you guys joining me on here. Guys, make sure if you don't like and share, like our page, follow our page, and also make sure that you share this video as well. Next week, I will be doing a topic. I haven't figured it out yet, but maybe I'll actually talk about here's how the immune system works. What do you think, guys? All right, here's how the immune system works. All right. So sorry, guys, I know that. Oh boy, almost lost the phone there. All right. So guys, any other questions? All right. I think I've gone through all of them. Doug Caffeine. I didn't say not to take a workout. I say that I just don't. So a workout with caffeine and creatine can help with performance a little bit. So normally, guys, not a weekly thing, but normally what I do is I have some kind of topic on Monday night. But sometimes if I'm traveling over the weekend and things, I don't have time to come up with topics. So I call it a question and answer. Should What vitamin should I have checked as a 30-year-old woman with hair loss? Here's the thing with here's the thing when it comes to checking for vitamins in the blood, because there's a lot of people who will do things like organic acid testing or vitamin and mineral deficiency testing and things like that. I don't think that's a good place to start off. And the reason why is because if someone's sick, it will all be off. For example, you're like, okay, I'm going to check my iron levels. Check your iron levels and you're deficient. You're like, okay, I guess I need to take more iron. Or you check your B12 levels. Oh, I'm deficient in B12. I'm going to have to take B12 as well. Oh, look at it. My CRP levels are really elevated. I guess I need to take turmeric as well. So you guys you see where you're going with this, is that you run into this never ending thing of just taking this for that and this for that. But look at it deeper. So I tell people, get to the inflammation talk, look at it deeper and say, maybe I'm deficient in iron. Is it because I'm not getting enough iron? Maybe I have an issue with stomach acid. And going even deeper, maybe that's an issue with chronic stress. Now what's causing the chronic stress? Maybe I'm having an issue with low B12 because I'm not absorbing it. So that's why I don't like vitamin tests. And this is even someone who used to do organic acid testing 7 to 8 years ago. And now I don't even do organic acid testing as well, because it just shows, hey, what you might be deficient in, but it still doesn't give you the picture of why. So go deeper. So if you're having hair loss at 30 years of age, go deeper than that, because chances are, if you're having some kind of issue with hair loss at 30, then it's going to be immune. It's going to be an immune system issue. That it can change your hormones, but I would always say it's immune. Look at the number of people who lost their hair after having a bout of COVID, and they had the shock loss. Well, what was causing that? That was immune, but you were probably deficient in some other things as well, that you became deficient with the immune system reaction. Okay. All right. Maybe I will talk about the immune system, because I've had some people try to argue with me online about why masks are amazing and why certain things are really amazing in order to prevent childhood illness and things like that. And it's tough because because we come from a different perspectives. Remember this, guys. You cannot inject yourself with a what in order to try to hide from every single virus out there. They're trying, which is why it's like, okay, if a child is getting 108, wait until they release the hounds, because it will go up to 250 to 300. Now tell me what's going to happen when it comes to that. You can't run away from these things. And that's why we always say, if the germ theory were true, 100% true, no one would be alive to even believe in it, because everybody would be dying from viruses and bacteria all the time. You have an immune system, you have a defense, you have a barrier. Now let's figure out how to make the immune system strong so that you can handle any virus. And that's where we have always come from. So we've always have come from, how do you make a person inhospitable for a virus or a bacteria to even be able to live inside of the body? It's a different perspective. And you know what? Over the last 3 years, if you still haven't done anything in order to check your immune system, or you haven't done anything in order to build up your immune system response, and you're going to still run for a mask, or you're going to get your whats, then you didn't learn anything. And I don't know what to tell you. You didn't learn anything. But I want you to go back. If that offends you, I want you to go back and watch all the videos. Go back on YouTube, watch all the videos of what I had said from the last 3 years. Go back and name anything that I was wrong in, and then go from there. Okay. So maybe I'll talk about the immune system and talk a little bit about, here's how it works and here's what you need to do. Okay. So, all right, guys, I think it's 8 o'clock. So maybe it's time for me to enjoy the rest of my evening. But guys, also make sure, thank you guys so much for your questions. Thank you guys so much for your follows. Thank you so much for your shares. I sincerely appreciate it. But I'll be back later on in the week. Keep following for more great information, for more great stuff. I appreciate all of you. I hope you guys have a great Labor Day. I hope you had a great weekend of rest. And now make sure that this week is awesome. Make sure that this week is amazing. So be blessed, be well. And as always, remember who you are.